In this presentation, I am going to discuss the management of a mature cataract with small pupil with the help of a BHEX pupil expander device. Mature cataract with small pupil is a challenging combination for every beginner phaco surgeon due to limited visualization, difficulty in capsulorhexis, increased risk of PCR, and incomplete cortical removal. All make surgery high risk. You can use a pupil dilating device, either iris hook or ring like BHEX or Malyugin ring. Use the one you are comfortable with. It may take you some extra time, but it helps to eliminate a greater difficulty. Today, I will demonstrate how the BHEX pupil expansion device can transform such a surgery into a safe and controlled procedure. This is a 65-year-old patient with moderately dilating pupil who is on tamsulosin for prostate problem. BHEX ring is a flexible hexagonal device made of polyamide. It provides a stable 6-point pupil expansion up to 5.5 mm. It has got thick strong flanges and thin flexible notches. 3 alternate flanges have got tabs for holding the device. It is thinner, less expensive and easier to remove compared to other ring devices like Malyugin ring. BHEX forceps is a reusable forceps with serrated jaws which open in a plane perpendicular to the squeeze handle. Now I have made the main incision and the side ports. After making the incisions, I introduced the OVD under the iris to create space. Then introduce the ring into the anterior chamber using the 23 gauge BHEX forceps. First flange is pushed under the iris, grasping the flange with holes, simultaneously ensuring that the notches on either side engage the pupillary border. Then the next flange with the holes are grasped through the side port using the BHEX forceps and pushed underneath the iris. Now use the other side port and repeat the same procedure. Now we have the 3 flanges above the iris and 3 below it with the 6 notches engaging the pupillary border. The next challenge is getting a decent sized rhexis to perform Phaco on mature cataract. At the same time, preventing a rhexis runoff in this case of mildly intumescent cataract. Be just inside the pupillary margin to get a decent sized rhexis, at the same time preventing a runoff. Get a decent sized rhexis which is at least 5.5 mm in size. In very intumescent cataract, you can do a 2-staged rhexis or a helical rhexis in order to prevent the Argentinian flag sign. Do hydro at multiple sites because one difficulty in small pupil is incomplete cortical removal. Good hydro helps your cortical aspiration easy. Now it's time to start the Phaco. In mature cataract, try to make the nucleus to smaller bits by multiple chopping maneuvers before emulsifying the pieces. It makes emulsification easy, uses less energy. Also, the larger pieces of nucleus can dislodge the thin BHEX device. So, it is always better to make the nuclear pieces to smaller bits before emulsification. Ensure complete separation of the nuclear pieces before starting the emulsification. The Phaco probe should always be at the center. In hard and brown cataract with leathery posterior plate, you can use chopper to make the chopping maneuvers easy. Cortical aspiration is performed as usual and IOL implantation should be done under Phaco. not under the BSS. Now it's time to remove the BHEX ring. For that, inject Visco to create space in AC. It is extremely easy to remove this device. Just disengage the flanges from the pupillary border using the BHEX forceps and the device is pulled out through the main incision. The pupil quickly regains its natural form without permanent distortion. To conclude, the BHEX pupil expansion ring is a simple, atraumatic and highly effective solution for managing small pupils in cataract, especially in challenging cases like mature cataracts. It reduces surgical stress, improves safety and enhances outcome. Take-home message is that mature cataract with small pupil is a challenging situation. BHEX makes it simple, learn it early and your surgery becomes safer. Thank you for watching.